Hey, this is Jessica DaMassa with WTF Health. I'm here in the HISA studio, and joining me right now, I have Professor Meredith Makeham. She is the Chief Medical Advisor for the Digital Health Agency in Australia. So it's a pleasure to have you, and you're also a practicing GP, which I think is really exciting. I haven't talked to a doctor about digital health yet today, so very cool. Good to have you.
Thanks for having me on the show, Jess.
Okay, so tell me a little bit about what's going on. I mean, the types of issues that you're addressing as a physician working with the Australian Digital Health Agency. Like, what's on the top of the agenda these days?
Yeah, well, look, I mean, there's a lot going on. We're in the midst of delivering what's called our National Digital Health Strategy for Australia, and one of our big pillars of that strategy is the My Health Record system.
Right.
So we've had a very exciting year. We've created records for every Australian who would like one. My Health Record is essentially a secure online summary of your health information that you can access, you can control, you can decide which healthcare providers can see. And if you'd like one of these, it collects health information from all of the securely connected health services that you visit in Australia. So delivering the My Health Record, we now have 90.1% of Australians who have a My Health Record, and that's very exciting.
Yeah.
And it's really going to transform the way we practice healthcare in Australia, I believe, because suddenly it's a new way for people to be empowered with access to their own health information, and for all the healthcare providers, GPs like me and everyone else trying to look after you and deliver safe and effective healthcare, it's a way we can see real information, real time for the person we're sitting with, and that's so incredibly important to make safe clinical decisions. I mean, we actually, have quite lots of issues in Australia where medicine safety or lack of access to pathology and imaging results and things like that are impacting on people's health and well-being. It's causing avoidable harm to people and avoidable admissions to hospital. It costs our health system, but more importantly, people are suffering harm unnecessarily. So we really want to fix all of those issues where we know that by simply providing access to that information, we can all make better decisions and together manage care better with our patients.
What's been the clinician reaction so far? I mean, because I'm coming from a background in the States, obviously, and we have a lot of physician, how do I say this, displeasure with the EMR system, and so either accessing or typing information in, and this is essentially that. And so how are things going here in Australia with the rollout? What do the clinicians think?
Yeah, look, I'd say that overall the clinical community have been incredibly supportive of having this sort of system in place.
Okay.
And we've seen that from all of our clinical leadership, all of the peak bodies, particularly the Royal Australian College of GPs, the AMA, also the consumer peak bodies like the Consumers Health Forum, the Pharmacy Guild, the Pharmaceutical Society of Australia, a lot of organisations that really want to see a system like this working and represent a lot of clinicians in Australia are very much behind this. I mean, there's always pockets of people, whenever you make a change in the way you work, I think there's always going to be a little bit of a lag for some people who need to think about how that affects the way they work, essentially. And look, I mean, to be fair, there's been I suppose a bit of a disenchantment with digital health amongst clinical communities internationally, really, over the last sort of 10 to 15 years as these things have come into play. But I think what's important now is that we're making huge steps forward and thinking about the way we actually co-design these products with clinicians and consumers and the industry and academics and everyone side by side. And I think that's made a big change the way this is working. The other thing that's made a big change is the value of that tool to people. So, for example, with the My Health Record system, we've seen a massive trajectory of the number of connected healthcare organisations around the country over the last even just 12 months. I mean, it's really phenomenal. So what that means is that My Health Record is suddenly becoming a much richer source of clinical information for people and much more important in terms of providing us with immediate access to those things we need.
So there's been good acceptance for it?
I think overall yes. I'd say yes. And I think people are now thinking about the way they can integrate it into their workflows. And it's still a relatively new tool, right? Mm-hmm. So we went from about a quarter of the population to 90% of the population having one. So, of course, that tips it over the point of people wanting to click and have a look.
The government is so behind it, and so I mean it's at their impetus. Yeah. So I mean it benefits everybody to have it involved. So I wanted to ask you, because you had said to me that some other countries are asking you guys how you went about rolling this out, and so I mean, first of all, who's asking you for some advice?
Oh, look, I mean, I'd say to start with, Australia should be very proud, because I really do think that in this field, which is called personal health records, which are these electronic summaries where you can access your own information and share with others, I think we are world leading. I think that's fair to say. And we've been approached by lots of other countries. Last week, the ambassador of Mexico reached out to us,
cool.
Lots of countries around the world, in fact, through a new collaboration we've established called the Global Digital Health Partnership, have turned to Australia to look at how we've implemented a personal health record, my health record, for our citizens. And around the world, it's quite unique actually to have a system like this. There's probably, between arguably 7 and 10 countries in the whole world that have something like this, and certainly not all of them have managed to implement it with the privacy and security controls that Australians enjoy, and the right to opt out of the system if you don't want one. Right. So a lot of countries, Scandinavian examples in particular, you might have a summary like this, but there's no potential to opt out of it if you don't want one. Most of the countries don't have the sophisticated privacy controls that people have around the Australian system.
Talk a little bit more about that. I was going to ask about the privacy and security around that, because right now this is a hot button issue all around the world in terms of healthcare. Is how can, and this is I think due to Cambridge Analytica and Facebook and other data breaches that have happened. So people are very concerned about their health data being protected. So how have you addressed that? Yeah,
look, my health record, as I said, it's got a suite of really sophisticated privacy controls around it. Security controls are another matter as well, and it's incredibly robustly protected in terms of the security measures around the system as well. In terms of the privacy controls that people have, first of all, obviously you can opt out and cancel your record altogether if you don't want one. Secondly, you can do things like put what we call a record access control on it. That's effectively a PIN. So unless you share that with a healthcare provider, they can't see anything in your record. You can also put a PIN like that on particular documents in the record, so you can actually pick and choose what you'd like people to be able to see. So some you might leave open, some you might put a pin on. You can also actually pick and choose which healthcare provider organisations you will allow access to your records. Okay. So that's quite an impressive feature. And you can set up...
when you say healthcare provider organisations, are you meaning hospitals?
Or general practices. Or,
so really
you've left a GP, you think, I don't want that person or that practice to see my record anymore. Click it. Turn it off.
Interesting.
Yeah, you can change all of these settings, of course. The other thing I was about to say, you can also set up email and text alerts in the system. So if a new healthcare provider organisation, like a new general practice, opened your record for the first time,
you would know about it.
You get a ping. Things like that. Cool. And the other thing that's really important for people to understand is that there's an audit history in My Health Records. So at all times you can see a running log in real time of anyone who's ever looked at your record, touched it in any way, including yourself actually. You turn up on that as well. But that's really important for people to be aware of too.
And then as far as the plans for using this, for the de-identified aggregate data by the government, where are you guys at as far as that goes? I mean, I know this just got rolled out, but I'm sure everybody's just itching to look at this from a population health standpoint and see what kind of trends they can discern from having that much data, health data all in one place. So where are you guys at with that part of this?
Sure. Well, that's a really hot topic internationally as well, and that's something we've been discussing with all 25 countries in the Global Digital Health Partnership quite a lot, actually, the secondary use of data. And in fact, Australia has had a really big think about this so far, and we've had our Department of Health has led on a policy framework that lays out how My Health Record data could potentially be used in the future for public good and research purposes in the public interest. And it's laid out a whole set of rules, if you like, and a way that the AIHW, which is our Australian Institute of Health and Welfare, will be what's called the data custodians of the data. But really, we're in the early stages of working out what the processes look like in an ethically controlled, governed way around that. In the meantime, we've already set up a switch in the My Health Record, which basically toggles on and off whether or not you'd like to have your data used for, de-identified data used for secondary public good purposes. So you can switch that off if you actually feel that you don't want your data used for that purpose also. But it's not actually necessary yet to think about that setting, because in fact it'll be another 12 to 24 months before that sort of data flows, if you like.
Sure. And I was going to ask too, so I mean, you've talked about like those who have access to the system. So it's like all of these different healthcare organizations that are, I mean, they're the big healthcare incumbents. Are there plans to open up my health record so that I can integrate my Apple Watch data into it eventually? Or is that something, because that's where the line starts to get, like, I mean, it's exciting, but it's like that's also where people start to worry then about these other startup companies that might have access to something like this volume of data and what they're going to use it for, because they're large multinational commercial companies. So, I mean, curious to know what the plan. I'm sure this has come up in discussion. So, what's the official party line?
Yeah, look, absolutely, and you're absolutely right by starting with the premise that any organisation that is able to connect to the My Health Record system has gone through a really rigorous set of circumstances where they're registered, they've got secure certificates in their software, they do special security handshakes with our system. We have to register as clinicians, we have to be registered with the AHPRA, our registration authority in Australia. So there's a whole lot of measures that actually control who can connect. In terms of allowing third-party apps, if you like, to connect to the record, we're in a conversation right now actually with community developers, government, working out what the community preferences are for how this might work in the future. So currently there are a small number of apps in fact that can connect to My Health Record for a view only, but they're not able to take any data or do any of the stuff you're talking about. No. So it's literally no. So but down the track, people may well want to see, depending on what your particular healthcare issue or interest might be. I mean, you might have diabetes, for example, and you want an app that helps you understand how best to manage your diabetes and prompt you with reminders and information, or you might want to know more about the medicines you're taking and have an app that helps.
Or if you have your DNA sequence and you want to just throw your whole genome in there, that'd be great.
Well, absolutely, it can't do that right now. So another conversation for the future.
No, but I'm just curious because I'm sure that this has come up many times. The other thing I wanted to ask, and we can end on this question, but I'm curious, when you're approached by these other countries that are interested in how you've done it, what are the most common things that they're asking after, and what advice do you give?
Do you know what? I think one of the most important things, I believe, to set up a system like this is really to think about the big picture of interoperability and the way that Australia has successfully set up healthcare identifiers for all of our citizens, all of our providers and all of our healthcare organisations. And that's actually the magic that makes the information flow around the system. So that's a really important and legislated starting point in Australia that actually makes all these things possible. And we're going through a really important conversation now as well. We're developing what's called the interoperability roadmap, where we're also having a conversation about what do people actually want to break down those silos in healthcare and allow data to flow, but to allow it to flow around the patient as the centre, around the consumer, and make sure that everything we do is actually focused on better health and wellbeing for Australians, and that's why we're doing all this stuff. So I'd say thinking about the basics of setting up the system, obviously, but really thinking about those big questions in interoperability and how you empower people and give them the right to access their own health information, but actually make that real.
Yeah, we're struggling with that still in the States, so it's exciting to hear how it's going here in Australia. Thank you so much, Meredith. It was a pleasure to speak with you. I'm Jessica DaMassa with WTF Health here at the HISA studio at HIC 2019. Thanks for joining us.